Yes. I want to play this clip that I just forgot to play because it goes back to your question about the superdelegates. It's not just the superdelegates that is the problem. It's all of the coverage in the first place. Let's watch this clip, which I have to load, from our friend Joy Reid.
And Mayor Pete calls that Medicare for all who want it. Now there's option 2, which is Medicare for all, which is at the center of Bernie Sanders and Elizabeth Warren's campaigns. Now there's been much hand-wringing over how the country would pay for something like this, which has led Warren to release a detailed plan on just how she would fund universal single-payer health care. So how will this affect your paycheck? Let's take a look. Okay, here's your paycheck. Oh wow, you're doing really well. Under Medicare for All, this line, let's show this line that shows your insurance premium. Oh, here we go. We have to swipe it. Oh, there we go. Who shows your insurance premium? There it is. That would actually go away. As Rachel Maddow would say, poof. You can't see it here, but your employer's contribution also poof. So maybe your boss will pay that money to you instead as more salary. One can hope. And then this line, swiping again, the one that shows, there it is, that shows your Medicare and Medicaid taxes, that stays the same under Warren's plan. So would your federal income tax, because Warren's plan finds other ways to pay to put everyone on Medicare. So that line also stays the same. That's why you hear her saying that your costs would go down. More health care, more paycheck, and a tax on billionaires to pay for it all, which may be why some people are not a fan.
I've paid over $10 billion in taxes. I paid more than anyone in taxes. But I'm glad to have paid, if I'd had to pay $20 billion, it's fine. But, when you say I should pay $100 billion, okay, then I'm starting to do a little math about what I have left over. Sorry, I'm just kidding.
Okay, joining me now is Wendell Potter, president of Business for Medicare for All. Okay, so Mr. Potter, yeah, that was my sort of awkward way of trying to explain Medicare for All. But did I get that basically right? That
you did.
Essentially, the line where you're paying for the insurance premiums would go away.
That's correct.
And the company's portion of your insurance premiums would also go away. So in effect, at least under Warren's plan, you'd end up with more money.
You would end up with more money in your paycheck. That's one of the things that's been happening over time. And one of the reasons why people are noticing they're not getting very big raises is that the money that our employers would ordinarily give us in raises, maybe bonuses, it's going to insurance companies instead.
Right.
One of the things that people don't realize is insurance companies don't really control health care costs. And they don't really want to, because as health care costs go up, so do premiums.
Right.
That means they get more money from us to convert to profit. So they have an incentive not to control healthcare costs. The average premium for a family now is $20,000 for a policy that you get through the workplace.
Right.
So I don't even know where to start, and I'm kind of surprised because Wendell Potter I actually like. He used to work for Big Pharma and basically has been a whistleblower ever since. He says, I was part of the people pushing the propaganda that against Medicare for All. So I'm kind of surprised he went along with this. I did a video last week on Elizabeth Warren's Medicare for All plan. But first of all, I love how Joy Reid makes it seem like Elizabeth Warren is the pioneer of Medicare for All, and her plan, which she just came up with 5 minutes ago, when Bernie Sanders wrote the damn bill. So anyway, we know Joy Reid is deranged about Bernie Sanders.
Yeah.
But the thing that stands out to me, I did a week or two ago, you might have missed it because you were working on the story. I put the headline, when they say Bernie's pie in the sky, I'm not a pie in the sky person. I think we have the money to pay for all this already.
Oh, absolutely.
But Elizabeth Warren's plan is actually pie in the sky. Its provisions, I don't know if you had a chance to look at it, are, well, we're going to, the money is, we're going to put a $9,500 employer head tax on. So every employee, the company's going to have to pay $9,500. Well, as Matt Brunig pointed out at the People's Policy Project, then employers are just going to bump people down to contract or freelance to avoid having full-time workers, so that they don't have to pay the $9,500 for Elizabeth Warren's Medicare for All plan. There's no rule in her plan. There's no control. We've already seen this where Obamacare, for example, more companies started knocking people from full-time down to 30 hours. or 35 hours to avoid them being full-time employees so that they didn't have to pay for their health care. So basically, Elizabeth Warren's plan, who other progressive people for Medicare for All have said, is actually going to depress jobs because employers will just skirt around that head tax by keeping people on freelance, contract, or whatever. That's just one part of it. Then the rest of her assumptions for the money that she's going to pay for it is we're going to pass immigration reform, something that hasn't happened in 30 years. We're going to pass, immigration reform. A defense cut. We're gonna cut the military, even though she's voted for both of Trump's insane military budgets that increase the military budget. So can you imagine if Bernie Sanders' Medicare for All plan pay-fors, as Nancy Pelosi likes to put it, were just the assumptions that, we'll just pass immigration reform, so money will come from that. Oh, and we'll pass that small thing like cutting the defense budget. It's ridiculous. It is a fantasy budget. I would rather Elizabeth Warren and, frankly, Bernie Sanders come out and say, you know how we're going to pay for it? We're going to cut the military in half. We're going to cut the subsidies to Goldman Sachs, to Pfizer, to Raytheon, and we're going to, instead of printing money for war, we're just going to print the money for this. Because I don't even think we need to pay for Medicare for All through an increase in our taxes. But like every other civilized country, Elizabeth Warren is trying to make it, she's twisting herself into a pretzel to try and say, I'm not going to raise middle-class taxes. No, what you're going to do with your plan is cut people's jobs because they're going to lose, companies are going to get creative so that they don't have those employees as full-time workers. And the rest of her plan, which Joy Reid is trying to make it seem like it's the gold plan for Medicare for All, is fantasy. Elizabeth Warren is not God. She's not going to just snap her finger and we're going to have immigration reform. She's also not going to snap her finger, neither will Bernie Sanders, by the way, and get defense budget cuts. Am I?
Right. No, I agree 100%.
Well, they say I don't let you talk, so is that all you want to say?
Yeah, I know. That is exactly my take too.
It's ridiculous. And Joy Reid, she sets up the segment like, isn't it true that under Elizabeth Warren's plan, their paychecks will go up? So it's a subtle way of trying to make it seem like Bernie Sanders' plan, your costs will go up. Elizabeth Warren's plan could possibly cut your job because you're forcing employers to pay that. I would prefer, if you ask me, instead of my employer, which could be a small business, having to pay that, I'd rather you already pay out of your paycheck a tax to go to Medicare and Social Security. All Bernie Sanders is talking about in his plan is your tax for Medicare and Social Security, or Medicare, is going to go up. You're going to be taxed more for Medicare in your paycheck or as a citizen. The parts of your paycheck that go towards health care go away. It's just Medicare. And that's it.
Right.
You go to the doctor. No copay, no deductible, no premium, no nada. It's just an increased tax for you. So the terms are what the media is preying on. Tax. Premiums are a tax. Copays are a tax. Deductibles are a tax. I'm sure you have 2 children. You've had hidden bills, even with insurance.
Yeah, and I have really good insurance, like really, really very lucky. And it's absolutely insane, even with that. And I do think, on the point of Bernie, he needs, I think, and you've said this before, they really need to do a better PR job of explaining how this is going to be paid and how it will actually affect people's daily lives. Because as of right now, the media can hit him on saying taxes on the middle class are going to rise, and obviously that's all people hear. And so they have an optics problem for sure. They need to do a much better job.
Well, I also credited Bernie because I thought, I think he went on, I think it was Jimmy Kimmel actually, recently, and it was the best articulation of the plan that I've heard from him, because he finally said, your taxes are going to go up a little bit, but the savings you're going to have from the reduction in the cost for healthcare, the savings from that are more than this tax increase. So overall, it's a tax. He didn't use the term tax cut. He should. But overall, you're saving money. He hasn't said it like that. He has said in the past, your taxes will go up, but your healthcare costs will go down, which doesn't immediately register that your overall costs will go down. Now he's explaining it on Jimmy Kimmel, I think it was, where he says, the tax increase you're going to get, I actually think he used a dollar amount. Like, Jimmy, let's say your taxes go up like $7,000, but you already pay $15,000 for your family. That goes away, and you're left with the $7,000.
Hope you enjoyed that last video. Hop on over to statuscoup.com where you can sign up for our email list and become a member for as low as $5 to $10 a month. Membership is how we grow. That's statuscoup.com/join. And remember, join our email list so we can grow the revolution with you.